Hello and welcome. This is Diamond Fernandez. I'm the founder and director of the HeartFit Clinic. We're leaders in cardiac rehabilitation, maintenance, and heart attack and stroke prevention. Are you at risk for heart disease? Are you going to get your heart checked? This will be a very important short video you must view. Have you been given a clean bill of health? Well, you may be still at risk. We have seen this so much, and I can't tell you how many people we've seen where they've had a physical or seen had a clean bill of health and then end up with a heart attack not so long afterwards. And we're going to explain why. And so let's look out and find out what's going on here. So if you were going to get your heart checked, you would probably go to your family doctor, and he would, of course, send you onwards to a cardiologist. Now, if you're getting your heart checked, the typical scenario is you walk in your doctor's office and you say, look, I would like to get my heart checked. And of course, they determine a valid reason for doing so, and then off you go to see this cardiologist. And you would see a heart specialist, and they would usually perform three tests. And the test that they would really focus on is an electrocardiogram, which is a simple test. You just lie on your back, and they hook these stickers onto you, and it just monitors the electrical activity of the heart. And from this ECG, your doctor can look at, they can see different changes in heart rhythm. They can see if if your heart's undergoing any type of arrhythmia or dysrhythmia while you are at rest. And the purpose of the test, like I said, is just to determine or detect any heart problems at that one moment in time. Then they might also do an echocardiogram. Again, this is a nice non-invasive test. It's an ultrasound of the heart, and it looks at the anatomy of the heart. So it looks at the walls of the heart, make sure they're moving properly, looks at the functions of all the ventricles and the atria, make sure like they're pumping like they're supposed to, and they also looks at the valves. And this is a really good test as well. They end up doing a stress test. And a stress test is to basically see how your heart responds while stressing it to its maximum. So they look at the heart via ECG, and now while exercising, they're looking for two things. They're looking for what we call ischemia, or the other thing, which is a lack of oxygen going to your heart, or they'll look at dysrhythmia, which is any funny rhythms happening while you're exercising. And the ECG technician will continuously monitor your heart rhythm for this, for ischemia, and see if there's any extra demand of blood flow while your heart undergoes this stress. So ideally, what is normal is, of course, no ischemia or no dysrhythmia. The great parts about all these tests is they're non-invasive and there's no radiation involved. And if they did see anything of problems, then they would take you on to the next step. But the most accurate test for detecting your risk and looking right inside the coronary arteries is an angiogram. And this is where they insert a catheter and they go right inside your coronary arteries where they can see where the arteries are clogged. Now this is a very invasive procedure and you're exposed to an immense amount of radiation. But as always, the benefits should outweigh the risk when you're exposing to radiation or the invasiveness of the test. And doctors will never do this test as a first line of test unless you're having a heart attack or they see obviously prior positive tests to make sure it's significant or to do so. Now, before a kind of a stepping stone before that test is something, if they see a positive stress test, it means that you have possible blocked arteries. I'm going to say that again. If they see a positive stress test, it means that they might be seeing a positive, there might be some blocked arteries going on. And doctors will send you onwards to what we call a myocardial perfusion scan. It's also called a thallium scan or a MIBI scan. Now this is a great test for looking further for coronary artery disease, but my concern with this is that there's an immense amount of radiation involved in doing this test. By all means, if you're having symptoms of heart disease such as angina or some query chest pain, then in my opinion this is absolutely necessary. But if you're not having any symptoms at all, then now the next step would be, in my opinion, to focus on lifestyle modification programs. And the research is showing that out there, that it's not of benefit to go in and do an angiogram and open up the arteries anymore if they're not having any symptoms. And it's really about treating the patient, you. And so if you're having any symptoms, then now the next step would be to do, if you're not having any symptoms, the next step would of course be to do a lifestyle modification program with exercise, nutrition, and stress management. So where do you fall? And this is a really good idea to see where you fall. Everyone is susceptible to heart disease, no matter what. And, um, of course, if you do have heart disease or possible clinical disease, you'll fall right there. And the purpose of a cardiac rehabilitation program is to prevent disability. And of course, we see many people who have had already a heart attack or heart problem. The idea is to prevent disability with it. Now, what if you are kind of in limbo? And I call these people in limbo. This means that the test may not show clinically significant, meaning that you don't have blocked arteries bad enough to show up on those tests yet. However, you may be on the path of one, and you might get a clean bill of health when you're pre-symptomatic, when you're on the verge of it, yet, and I see this so much, is that, and it's no fault to their own, doctors want to see people who, and treat people who are really at risk. And if you're not at risk, if you're in limbo, they'll give you a clean bill of health, although you might be on the path of a heart attack or stroke. And so what do I mean by this? And let's go ahead and look at this slide here. And you can see that this one's a really good model of what heart disease actually looks like. Let's see if we can get this one moving here. I don't know if we actually will. But nevertheless, we can see that this is a nice arterial wall, look of the arterial wall. And if you have disease happening inside the arterial wall, it can be moderate or small, but it can progress to a point where then there is problems or there are concerns. Now, if you are having a heart attack or angina, you should, of course, proceed to the nearest emergency as quick as you can, because the sooner you get there, the less damage to your heart. And if you go to emergency and if they do not determine it as a heart attack, just don't stop there. You have to take charge of your heart health. Hopefully that'll be alarming. So in finishing here, it is so important to know your numbers and know your risk. If you have any of these risk factors, if you are physically inactive, if you have high blood pressure, if you're overweight or have an increased waist girth, usually for males above 38 inches or women above 35 inches, if you have high blood sugar or diabetic, if you have stress, if you are smoking, or if you have abnormal cholesterol profile, you might be given a clean bill of health with those cardiology non-invasive tests. Does not mean that you should neglect your risk factor profile. 70%, over 70% of heart attacks is due to neglect. So you may be, like I said, you may have been given a clean bill of health, but if you are really wanting to take control of your heart health, you have to take control of all your risk factors and understand your emerging risk factors to heart disease. It's important to get like a carotid IMT scan and understand the other emerging risk factors and blood tests you can do to find out really what is your risk of heart disease and stroke. So again, this is Diamond Fernandez, and if you have any of these risk factors, please do not neglect. You may have been given a clean bill of health, but if you really want to take control of your heart health, take control of your risk factors, and contact us today. You may contact us anytime, www.heartfit.ca, and here's to your heart health and your success. Live happier, healthier, and longer.